We will also try to manage questions throughout the webinar, so please feel free to use the questions box for this or the chat, whichever is most convenient for you. We will also allow a little bit of time at the end of the webinar for questions as well. Also, we'll be recording this webinar and we'll have it posted on the Brain Injury Alliance of Iowa website within the next few days. So if you know anyone who wasn't able to attend today, please feel free to refer them to our website so they can watch the broadcast at a later date. Without further ado, I will go ahead and unmute Diane and let her and Brian get started. Thanks, guys.
No problem. So again, I am Diane Hernandez.
And I'm Brian Dennis.
And we are the Disability Resource Team at Iowa Employment Solutions at DMAC, which is the workforce. We work in the workforce office here in Des Moines and serve the Central Iowa region. And what we're going to be going over today is basically we're going to be doing some work on benefits and how going back to work can affect your benefits, specifically SSI and SSDI. The purpose of today's webinar is not so that you guys get all of this down. So we're going to be going through things kind of fast. This is a lot of information to cover in an hour, and we're not expecting for you to have all the information you need to be a benefits planner at the end of this. It's more so that you kind of have a general overview of what it looks like, and you know kind of what you would be talking about were you to be meeting with a benefits planner and sort of have some idea of how these things work. So when we work, we're working with people with disabilities, and we find that often one of the things that people with disabilities, whether that be traumatic brain injury or other disabilities, are concerned about is how going back to work might affect their benefits. And people have this idea that going back to work after benefits is going to be like jumping off at the deep end of the pool. And what we're here to assure you today is that it's not. It's more like this picture here. It's whether you're on SSI or SSDI, it is a step-down process. It is a gradual introduction to self-sufficiency and a gradual process of getting off these benefits. And there's lots of what are called work incentives, but things that are going to help make that process as easy as possible. And to make that process as easy as possible, one of the best things that you can do is actually work with a benefits planner, which is someone who knows this stuff inside out. Even when you're working with Social Security, you may find at times that they are used to working with retirement portion of Social Security and not disability. And so working with a benefits planner, who that's the main area of expertise, like Brian Dennis here, can be terribly helpful to you. So I'm going to turn this over to Brian and let him discuss the disability benefits programs.
Good afternoon, everyone. As Diane said, my name is Brian Dennis, and I am the Social Security Benefits Planner here as part of our team. We'll talk a bit more about the benefits of working with a certified benefits planner towards the end of our presentation, but again, this is not so you guys are certified benefits planners. It is so you know some of the basics, some of the most common questions, so you feel comfortable with that and try to remove some of the mystery. So the first thing I want to mention is I like to say that Social Security has a really big butt. And the reason that I say that is that for everything that we're going to cover in today's presentation, there very well may be an unusual circumstance that applies to your person. So we're talking about things in very general terms that should apply to 99% of the situations that our shared customers encounter, but there may be some unusual circumstances why, again, is the benefit of working with a benefits planner. One of the first things when we're talking about disability benefits is understanding the difference between the different disability benefits programs. I find most common when people call in, they'll say they receive Social Security or they'll say they receive disability, and they very well may be on one program or another, or they may be on both. So just to cover the difference between the two, Social Security has two different programs for persons who receive a Social Security benefit based on having a disability. One of those is what's called Social Security Disability Insurance. You may hear it called SSDI. That is true disability. So if a person receives disability proper, they're receiving what we call a Title II benefit, or what most people would call SSDI. That is a benefit program that is given to them because there's someone who has worked. All right, and when we get into more of the details, we'll explain to you those different groups, but typically For a person to receive disability benefits, either they have worked, they are the child of someone who has worked, or they are the widow of an individual who has worked. But all of those programs kind of fall underneath the disability benefits umbrella. Disability also comes with Medicare. And I understand that a lot of our terms sound very similar and it's easy to get confused. But the important thing is to remember that when a person is on disability benefits, the insurance that they get automatically is called Medicare. Disability benefits also vary in the amount that a person gets. Disability is like a replacement paycheck. Imagine someone hitting fast forward on retirement benefits, that's disability. So the example I love to use that if two individuals both become disabled at the same time, one was an attorney and one was a custodian, you would assume that the attorney gets a higher disability benefit because the attorney would most likely have made more money during their work life. Disability benefits are also always received either on the 3rd of a month or on a selected Wednesday of a month. So if you're talking to someone and they're saying that they're on disability, an easy thing to ask is, when do you get your check? If they say the 3rd or something like the 2nd Wednesday, the 3rd Wednesday, that is someone that's on disability. And the last thing is that disability, when a person is working, their work income is counted when it is earned. So when the person actually worked to receive the benefits, and that'll come more into play later. The other program that individuals participate in when they receive a Social Security benefit based on having disability is SSI. That stands for Supplemental Security Income. Now, SSI, different than disability, which is an entitlement program based on a certain insured status, SSI is a needs-based program. It's paid out of our tax dollars. Some people call it a welfare program. And one of the biggest differences is that Medicaid comes with SSI, at least in the state of Iowa. Medicare is a federal program, Medicaid is a state program, and SSI comes with Medicaid automatically in the state of Iowa. SSI also has a set amount of $733 a month. That's the maximum that a single individual can get. SSI checks are also received on the 1st. Again, a really simple trick to find out which benefit a person receives is asked them when they get their check. If they say they get their check typically on the 1st of the month, that person is receiving SSI. And SSI is a benefit. SSI is a benefit that's received when, work affects SSI in that the income is counted when it is received, so when they actually receive their paychecks.
Okay, so first we're going to cover over SSDI, and I'm going to give a brief description of what SSDI is. Like Brian said, it's Social Security Disability Insurance. It works a lot like insurance. So when you are working and you are paying into your FICA tax or paying into Social Security, you're earning work credits. Those work credits are then used to figure out your SSDI payment amount. So if you get SSDI, it's because you've worked in the past or you're associated with someone who worked in the past, and you're getting that benefit based on those work credits. It's an all or nothing program. So once they figure out the amount, you're either going to get that check or you're not going to get that check. They're not going to say, well, now it looks like you're like 50% as disabled as you used to be, so we're going to give you 50%. Nothing like that happens. It's either you're getting it or you're not getting it, and it's all based on your earned income. And earned income is specifically the stuff that you get, the money that you get from work. So if you win the lottery, if you get a big inheritance, if you have a lot of money in the bank, if somebody just comes up and hands you a big bag of money, all of those things mean that you are very, very lucky, and that you also are continuing to get your SSDI benefits and your SSDI cash benefit. So who qualifies for this? Again, it's the person who contributed to the FICA tax. It's the person who contributed to the Social Security program through work. You have to meet Social Security's definition of disability, which means generally, I mean, it's a little bit more complicated than this, but generally Social Security depends on somebody who they believe has experienced a disability that is going to keep them from being able to work at a substantial amount for more than a year. So that's a general idea. And again, you can receive it by being the dependent of a qualified worker, and you can be working off that from that way. Or if you are the qualified worker, And the other thing to keep in mind about Social Security disability insurance is that there's a 5-month waiting period from the onset of disability. So if you are in an accident today and become disabled, 5 full months have to go by before you could possibly get your check. The earliest you could get your check is the beginning of the 6th month after the disability's occurrence. Again, as Brian said, the medical benefit that comes with SSDI is Medicare. Medicare is going to kick in after 2 years of receiving the cash benefit. So once you start getting SSDI cash benefits, you're going to get 24 checks of the cash benefit, and on that 25th check, that Medicare is going to kick in. There's some disabilities where they waive that 2-year waiting period before you're on Medicare, such as kidney failure or ALS, but for the most part, you can consider that the 2 years. Okay.
Also, when it comes to Medicare, your individuals that you're serving, they will get a letter from Medicare with their Medicare cards, usually 3 to 4 months before the insurance actually kicks on. So this is not anything they need to apply for. When an individual begins receiving disability benefits, once they get within a few months of that 24 months expiring, they will get their cards in the mail, and the card itself will say the month that it becomes active. So it may say July of 2015. Some people very well may be getting getting their cards now, saying that their Medicare benefits will start this summer.
And then there's 4 parts to that Medicare benefit. So there's Part A, which is the hospitalization part, which is free. There's Part B, which is medical services or doctor visits, and that's going to come with a premium. So they're going to pay $104.90 for that. Part C doesn't really apply. Not many people use that anymore. And then Part D is the prescription drug plan. So like most insurances, there's the hospitalization, the part where for regular doctor visits, and the prescription plan. People who are on Medicare can also apply for, if they're working, to MEPD or Medicaid for employed people with disabilities, which means that they'd be co-enrolled in Medicaid and Medicare. To get MEPD, you have to have a disability, you have to have some earned income, so you have to be making money from somewhere. You have to be under 65. There are income and resource requirements, but they're much higher than the income and resource requirements for SSI. So it's people with a little bit more money coming in or a little bit more money in the bank can qualify for Medicaid through this program. And one of the cool things is if they get on MEPD, the MEPD, because Medicaid is paid by the state and Medicare is paid by the federal government, it behooves the state for you to be on that Medicare program and be getting those doctor visits in. So Medicaid will pay that premium for that doctor visit portion. This is the portion that we're here to talk about today, which is the work incentives, which is one of the benefits that you get from being on SSI or SSDI. And the work incentives for Social Security disability are trial work periods, extended period of eligibility, and expedited reinstatement. This is the part that is the steps that I was showing you before. These are the steps into the pool. These are the things that keep you from having to jump up on the deep end or take on the high dive, right? So let's go into these 3 stages. The first stage is known as the trial work period. Trial work periods are 9 trial work periods, and what I want you to do is picture that you have in front of you 9 tickets, 9 passes. So there's 9 tickets in front of you, and how are you going to utilize those 9 tickets? You utilize those 9 tickets by going over the trial work period amount, which changes every year, but for 2015 it's $780. So in a month, if you go over $780, it doesn't matter how much you go over $780, you're going to utilize one of those trial work periods. So even if Donald Trump hired you to polish gold for $5,000 a month, you are going to still get your SSDI payment for as long as you're in those trial month work periods. So, okay, so you got your 9 tickets in front of you, right? So let's say you go to work tomorrow, and so you're starting work in April, and in April you work and you make $800. Is $800 more than $780? Yes, it is. So therefore, you're going to utilize one of those tickets that you had in front of you. Now you've got 8 tickets. May comes along, you make $1,200. Is $1,200 more than $780? It is in fact more than 780. Therefore, you're going to use that second one. Now you've got 7 tickets in front of you. But April, May, June comes along and something goes wrong and you only make $600. If you only earn $600, you don't use that trial work period, so you still have all of those 7 tickets in front of you, right? If July comes along, you make $1,000, you're using a ticket. The next month, it goes on and on and on like that. So you can stretch out the way that you use trial work periods. A lot of times what we'll see is maybe you go back to work in April, you get a job, you work that job and you're making $1,000 a month, and you work that job for 3 months. So let's say April, May, and June. You've used 3 of your trial work periods, but at the end of June, you start to realize this is just not working out. This is not a good job match. So you stop working then, and you don't work again for a year. It takes you a year to kind of get your feet back from under you and start working again. Use those 3 in that first job, and then when you find Wonder job a year from now that's making $1,500 a month, you immediately, that job is working out fabulous, so you run through those next 6 trial work periods. Just know you have those tickets. Every time you use one, it's gone. And then you just don't need to worry at all. It's not going to jeopardize your cash benefits at all until all 9 are gone. Do we have any questions about trial work periods? And assuming that we don't, we're going to go on to the next stage, which is the extended period of eligibility. The extended period of eligibility is a 3-month period. It is a clock that starts ticking the moment that you are through those trial work periods. So when that 9th trial work period ends, whether you're working or not, the clock starts ticking. And that clock is for that 36-month, 3-year period. Now, what happens during that time? During that time, for all basic purposes, if you make over a certain amount, which is known as substantial gainful activity, or SGA, you will not, if you make over that amount, you're not qualified to receive your cash benefit. If you make under that amount, you are qualified to receive your cash benefit. So in 2015, if you were in your extended period of eligibility and you made 1090 or above, you would be not qualified for your cash benefit. If you made 1089 or below, you would be qualified for your cash benefit. So what happens the first time that you go over SGA after you finish those trial work periods? The very first time it happens, let's say it was in April, Social Security is not going to know until the end of April that you've gone over SGA in April. So sometime in sort of towards the end of May, you'd probably be getting a letter, and it would say, you went over SGA, and so now we're going to cease your benefits. But you're going to be in a thing called the grace period. So we're going to give you 3 months of grace period where we're going to continue your cash benefit. And that's going to count for the first month that you went over SGA and the following 2 months. So if April was the month that you went over SGA, then you would know that you would be getting your cash benefit for April, May, and June. And July would be the first month that you should expect to not get a cash benefit if you're still making over SGA. Your Medicare would continue, your Medicaid would continue, but that reinstatement during that extended period of eligibility is automatic. So if you make over SGA, you don't get your check, or you don't qualify for the check amount. If you make under SGA, you do qualify for the check amount, and that can vary from month to month based on your earned income. Are there any questions about extended period of eligibility? All right. So then what happens after that? After that, you're in expedited reinstatement. What that means is as soon as you've clicked through, so let's say you've gone through the 9 months of trial work period, all right? Now you've gone through the 3 years of your extended period of eligibility, and now you're in expedited reinstatement. At expedited reinstatement, the first time that you go over SGA during that time, after everything else is over, you're going to get a letter from Social Security that says that they have terminated your check. From the moment that they terminate your check, you have 5 years or 60 months when, if because of the original disability that you had, you could no longer work over SGA, then all you would have to do is call up Social Security and say, for my original disability, I can no longer work over SGA and I need you to reinstate my benefits. When they reinstated, they'd be reinstating based on the amount that it was the first time. And they would start that immediately, and then they would have 6 months to do a medical disability review. The difference between...
We have a question just asking for SGA to be talked about again, the definition of SGA.
Yeah, Brian.
Okay. And again, this is Brian. So SGA stands for Substantial Gainful Activity. What this means is one of the common mistakes that people, or one of the common myths about receiving Social Security disability benefits is that Social Security needs to feel that you cannot work, that it's a white and black issue. Yes, you can work and no, you cannot. It is not that clear point. Social Security looks at employment as shades of gray. So what Social Security does is that it establishes what they consider substantial gainful activity, which is a sign that you can work enough to support yourself. So one of the reasons why people get either disability or SSI benefits is that Social Security looks at you and feels that you cannot work enough to support yourself. And that's kind of the end of that sentence that oftentimes is missed. If a person can work 2 hours a week, they probably cannot make enough income to support themselves. So yes, they can work, but technically they can't work enough to support themselves. Substantial gainful activity is a sign that Social Security feels that you, me, the man in the moon, can work enough to support ourselves. That number changes every year. It typically either goes up or stays the same. It never goes backwards. That number, when they put a dollar amount on it, is for this year $1,090 if you are not blind, and it's $1,820 if you are blind. That number is also gross. Okay, so unless you're self-employed, Social Security counts your income before taxes. If you're self-employed, Social Security counts it a net after all of your taxes and work expenses have been taken out of it. But SGA is really just a dollar amount or signal that an individual is able to work enough to make enough money to support themselves. We can argue over whether or not 1,090 or even 1,820 is actually enough to live off of, but again, that's the bar that Social Security has set for our current year. Again, it typically goes up, and when it goes up, it's usually about $20 per month.
So, so for SGA for 2015, it's 1090. For 2016, it might be 10. It might be 10.
It probably will be $1,100, $1,120, somewhere in there.
Yeah, $1,100. It probably be around there, or it could stay the same. But it's 1090 for 2015. And where SGA comes in is, again, if you were in your period of extended eligibility, if you went over that amount, you would not get a check, or you would not qualify for your check. If you make under that amount, then you do qualify for your check when you're in the period of extended eligibility. Then it comes into play again when you're in expedited reinstatement. When you're going expedited reinstatement, what that number triggers is that it's going to terminate your check, and for you to get your check back, you have to call Social Security and say, while in the past, because that's the reason that you terminated my check, I was able to work over SGA. Due to my original disability, I am no longer able to work at SGA. And at that point, they would say, okay, then they would reinstate your check, and then they would come through and do a disability review. So like I said before, if you have never received SSDI before, if you've never been on benefits before, you contact Social Security, you establish disability, and then they start your check. When you are doing that same process under expedited reinstatement, what happens is you say, because of my original disability, I'm no longer able to work above that substantial gainful activity amount. They start your check, and then they have 6 months to establish whether or not that you do have the disability. And even if they ended up deciding that you didn't, that they were not going to continue your check, that 6 months while you were in the review process, you would be able to keep that money.
Diane, we have another question.
Okay.
Is SGA impacted by other long-term disability benefits?
When you say impacted, if you're meaning is the amount affected? No. The only thing, when a person is on disability, we're going to talk about the difference between disability and SSI here in a moment. But for disability purposes, the only thing that can affect a person continue to receive their disability benefits is one, if they're medically no longer considered disabled. So if their disability gets better or goes away. For most of the folks that we see, the disability status of having a disability probably is not going to go away. The other thing that can affect it is earned income. When you're on disability, the only money that can affect whether or not you get your check, so that can be counted towards the SGA, is money from work that you earn, your earnings. So if I'm on disability and I win the lottery, I'm very lucky, but that does not cost me my disability benefits. If I'm married to someone who makes a lot of money, I'm married to a physician, let's say, their income does not affect whether I receive an SSDI benefit. I inherit money. Does not matter when it comes to SSDI. When a person is on disability, the only income that is counted in figuring the SGA is earned income by the beneficiary. So my money from work, that's the only income that disability looks at for determining substantial gainful activity.
And again, that's if you're on SSDI. The situation is different if you're on SSI, but we're going to be going over SSI in a minute. So under SSDI, the only money that counts is that earned money, the money that you make from work. So we've gone through. Do you have any other questions?
I don't see any other questions right now.
So we've gone through trial work period, extended period of eligibility, and expedited reinstatement, and all of those are things that are affected by the amount of work that you're doing. Now, and then you also have your Medicare. A lot of people are not even worried about the cash benefit. What they're worried about is Medicare, and all you need, and yet it's a very simple thing to explain. After you've gone through your trial work periods, you have at least 93 months, that's 7 years and 9 months, plus the 9 months of trial work period, so well over 8 years at least, before you're going to even have to be concerned about Medicare stopping. Medicare is going to continue for that time, and even if it discontinued at some point, you might be able to purchase into Medicare coverage. So the fear over losing your Medicare is not necessarily even close to what a lot of people are afraid is going to happen when they go back to work. But all of this is contingent upon Social Security knowing what's going on. You have to communicate with Social Security in order for them to be able to know this information. So you need to be able to keep good track of whether or not you should be receiving. And when I was talking earlier about, okay, if you make over SGA, you're not qualified for your cash benefit, and if you make under SGA, you are qualified for your cash benefit, that doesn't mean that you didn't get a check. Because Social Security at least has a little bit of lag, because they don't, even if you were telling them, they can't know what you made in April until April's done. And also, if you're not telling Social Security, they're not going to know. They will find out eventually. So if you were not supposed to receive your check because you were in your extended period of eligibility and you made over the SGA amount, so you were not supposed to receive your check, they probably are going to send it anyway, because they're not going to know. But then whenever they figure it out, which could be 2 years or so later, then they're going to want that money back. So it's important that you didn't spend it during that time. So you need to make sure that you know what you were supposed to get and what you weren't supposed to get, and that you're communicating that information to Social Security so that they can be acting in the most timely manner possible. And one of the things that will help you with making sure that that communication is as clear as possible is working with a benefits planner. And even if you're outside of this area, we're going to go over at the end of this presentation how you can find a disability benefits planner in whatever area of Iowa you are living in. And now we're going to move on and let Brian talk a little bit about SSI.
Okay. Before getting to SSI, one of the things I want to make sure everyone is clear of is, as much as Diane and I are discussing, and we've had some great questions, you will have questions when we're done. That's absolutely fine. Feel free to contact us, as well as going to be some resources for other benefits plans you can find across the state of Iowa to connect with, because again, this is a lot of information. One of the big things that you may want to talk to your customers about is, as you're looking at going back to work, they are going to get letters from Social Security. They typically would get those letters from Social Security towards the end of the week, and so they will have the weekend to mull those things over. I believe those letters are sent out intentionally to be received at the end of the week. Social Security will probably say they give you those, they give the weekend to think about it. What happens, most people panic. Social Security letters are always, always, always strongly worded where it makes it sound like the world is going to crash in on the individual because they looked at going back to work. That is why it is such a good idea to have a good relationships at the very least with the benefits planner, but you can get a relationship with your Social Security office. That can also be beneficial because more often than not, the letters are not nearly as apocalyptic as they may sound. I have lots of customers that Diane and I share that call us and just read us the letters. I've had an incident with a lady who actually was going to be getting more money, but because of the way the letter was written, she thought she was in trouble. Just let the person that you serve know that when you get a letter from Social Security, it can sometimes sound like the end of the world is coming, but it is not. Also let the family and support to the person that you serve know that as well. More often than not, when Social Security sends you a letter, it sounds worse than what it is. Let's remember they have millions of customers.
And if you are a family member or you are somebody with a brain injury and you get a letter and you find it scary, then do know there's lots of contact information at the end of this that'll tell you where it is that you can reach out for help and help you understand and decipher what they're saying.
Right. Because they have millions of customers, they write those letters strongly to try and make sure that people respond. Unfortunately, that can sound a little scary. So as Diane said, if you get one of those letters, if it's unclear, which oftentimes they are not, please contact a benefits planner, a support service, and we can work together to help you figure out what the letter is asking.
Brian, we have another question.
Yeah.
We have someone asking if will you be talking about the new ABLE Act that was signed into federal legislation 2 months ago by Obama?
That is definitely not part of this PowerPoint. I am not an expert on the ABLE Act. What I have seen from reading it is while it has been signed into law, it does not become effective until later this year as far as financial institutions being able to participate in the ABLE Act. Again, I am not speaking as an expert on the ABLE Act, but I do know that one of the things that the ABLE Act allows an individual to do is to set up a bank account that the money in that account is not counted against support services through things like Social Security or DHS. That oftentimes is the biggest question mark that the folks we serve have is, hey, I'm working, I'm putting money in the bank, which is oftentimes the bigger issue is not even necessarily working, it is saving money. And that ties into SSI because SSI has a lot of those resource restrictions on it. Is I want to save money to buy a car, to buy a house, to put towards my children's education, to pay off debt. There's a vast variety of things that happen, and unfortunately, SSI and a lot of programs through DHS, they have some performance punishers if you let yourself get too much money in the bank. The ABLE Act will allow individuals to establish bank accounts that I believe let them save $14,000 a year. That is not counted against services through either Social Security or DHS, as well as that others can put money in those accounts. So if you have a family member, a natural support, someone that wants to contribute to helping you with your financial security, they again can place money in that account without it affecting you. But unfortunately, we're not going to that much detail about the Iowa ABLE Act. I will see as that we get closer to that ABLE Act actually taking ground, taking root in our community, we will have more information on that, I'm sure.
And we do have another question if you have time. If not, we can wait till the end. But someone is wondering if you can explain the relationship with Section 8, rent subsidies, and how they're affected by working, if you have time to answer.
Yeah. I do. My previous life before doing this was I actually worked for Section 8, so we are in luck there. Okay. So again, let me say this. What I'm going to say is very general when it comes to Section 8. Every Section 8 office sets up their own policies to a certain extent. So these are in large strokes, and then you would definitely want to talk to your individual housing authority to see how they look at it. When an individual is working, though, one of the big benefits for the person that we serve, who are on disability SSI benefits is what is called the Earned Income Disregard. You will hear it called EID, often within the Housing Authority offices. What EID is this: it is a partnership between Social Security and Section 8, well, between Social Security and housing subsidies, I should say. What it allows is, and I'm going to pick on Diane for a minute, if Diane receives either disability or SSI benefits, and she returns to work after, and that's the big bullet in there, it's after she receives those benefits for the first year that Diane is working, housing does not count those wages against her rent. So I'll give an example. Let's say that Diane gets a job and the job pays her $20,000 a year. Diane will still need to report those wages to housing like she would normally. What her housing case manager would do is they would list that she makes $20,000 a year, or however much that is a month, and what they would do is they would exclude it. So let's say that's $1,500 a month. I'm fuzzy on my math there, but let's say it's $1,500 a month. They put in she makes $1,500 for the month of March, then they will take out $1,500 so it zeroes out. So what that means is that her rent stays based strictly on her benefit amount. The second year that Diane works, or the second 12 months of that period of time, they only count half of it. So if Diane is still working that same job making $20,000 a year, they do count her income, but what happens is they only count half of it. So while she's truly making $20,000 in a year, they only count $10,000 of it. So what that means is for the first year that an individual is working, typically their rent does not change. It is based strictly on their benefits, not their wages. And the second year, while it is counted, it only goes up by half of what it should. So what that means is some individuals may actually be making over income to receive a housing subsidy. They actually would continue receiving their housing subsidy because only half their wages are covered. So it's not until we move into year 3 that their full wages are counted against them. Again, it is a financial literacy incentive. It's a work incentive to help individuals who receive disability or SSI benefits save money where they can transition off of that public assistance. Any other questions? We've received an error message on our computer. Are we still connected?
I still see you guys. Yep, I think you're good.
Okay, perfect. Okay, as long as you're still showing us, that's fine. Okay.
Yeah, we're just getting a message here that says that there's a problem, so we're just trying to make sure that that's not the case.
Okay, but if you can still see us, we'll continue forward.
Perfect.
So unless there are other questions, I'll move into SSI. Okay, and just as far as questions, it's more important to us to answer any questions that you may have than for us to get through the entire presentation. So please, if you have questions, don't hesitate to ask. With SSI, what we've gone over so far is disability. We talked about how disability is not affected by things such as how much money you have in the bank, how many cars you own, how many houses you own, how much money your spouse makes, all those circumstances. Well, in SSI, all of those things matter. One of the reasons why that is that SSI is a needs-based program. Here's the big difference between the SSI program and disability. A person does not have to be considered more or less disabled to determine if they receive disability or SSI benefits. The standard for receiving disability and the standard for receiving SSI are identical. The difference comes here. If Diane has worked in her lifetime and she's generated enough work credits in her career, she will get a disability benefit. If Diane has not done that, so she's worked very little, perhaps she is born with a disability, she experiences a disability when she's young and she never moves to employment by the time she's applying for benefits, the benefit she'll receive is SSI. SSI benefits are given to folks who meet Social Security's disability standard, but they don't have an insured worker's work record to draw benefit off of. So they don't qualify for their own work record, and there's not another person's work record they can draw off of. So SSI, again, is needs-based. So again, it is a very small amount of money. SSI is paid out of general tax dollars, and it is such a small amount of money because it is meant to only cover your needs for basic food and shelter. In the state of Iowa, if you receive SSI, you automatically receive Medicaid. Some folks call it Title 19. Now, this is the point I want to talk about for just a second, is SSI comes with Medicaid in the state of Iowa. Iowa's called a 1634 state, which means that if you receive SSI benefits, you automatically receive Title 19. And I know we're talking to Iowa folks, but if you in your career, if it leads you to someplace other than the state of Iowa, or you have colleagues that are not in the state of Iowa, you should really check with the rules for your state. Most states, if you receive SSI, you do get Title 19, but not all states in our country have that rule. Some basic eligibility rules: if a person is 65 and they don't qualify for like a retirement benefits, they would get SSI. If a person is blind or disabled and they meet an income and resource test, which we'll talk about here in a moment, they have certain citizenship and residency requirements, and they must file an application. Again, this is something that you would want to talk to a benefits planner about, but if you're serving an individual who is not a United States citizen and they're receiving SSI, you should really talk to a benefits planner, because there is a time limit on how long non-citizens can receive SSI benefits. SSI has a fixed amount that it can be. When we talked about disability, I gave the example of if a person is an attorney, they'll make more than a person who is a custodian, let's say. On SSI, there is what's called the federal benefit rate, which means there's a maximum amount that a person can receive. That amount of money, if you're an individual in 2015, is $733 a month. If you're an eligible couple means that both individuals are eligible for SSI. Those persons receive a combined check of $1,100. So while I'm not a math professor, if you do the math, if two individuals get $733, but a couple gets $1,100, as you can see, there is an effect if a person who receives SSI gets married. I don't tell anyone whether or not they should get married or not, but understand that on SSI, if a person gets married, it can have a financial influence. It is also not as simple as getting married. If Social Security deems you are living as a couple, you have the same effect. Some things that can cause that would be if you share a bank account with an individual, if both your names are on the lease and you're a couple, not roommates. If you represent yourselves as a couple, Social Security could feel that you are now becoming an eligible couple, and that can affect your benefits.
Brian, we have another question. Is there a cost for working with a benefits planner?
Yes.
Is there a cost for working with a benefits planner?
No, there are no costs for working with a benefits planner. I will say that if you contact the benefits planner and I say that as far as my knowledge, but if you contact the benefits planner and they say there is a cost for their services, I suggest you use your resources and find another benefits planner. Every benefits planner that I know in our community, their services are free of charge. However, there may be some for-profit benefits planners out there. I would say that if you find one that wants to charge for their services, you can find plenty that do not. And I would suggest you find a benefits planner that there is no charge for service.
All right, thank you.
Yes, ma'am. Any other questions? Okay, so let's talk about how income affects SSI benefits. Looking at the time, I will go through these a little quickly, but please do not hesitate to stop me if you have a question. So income that affects SSI, first off, is unearned income. This is a big one. On disability, only income that can be counted against your benefits is money that you make from work. On SSI, almost all income can be counted against you, whether you earned it or not, whether you worked to receive it or not. Wages can be counted against you, both gross and net, and in-kind support and maintenance from others. And we'll talk a bit about what that means here in just a moment. Some common unearned income is one of the first things is Social Security Title II benefits. That's disability. Some individuals receive both disability and SSI, and in those cases, that disability benefit is counted against their SSI. If a person receives unemployment, if a person receives things like workers' comp, veterans benefits, child support, if they receive FIP, in other states they'll call that TANF. If they receive basically a needs-based or a welfare benefit, that can also be counted against their benefits. In fact, I believe in most FIP or TANF programs, you cannot receive both SSI and TANF or FIP at the same time. I'll talk a moment about what in-kind support and maintenance is. I'll cover this quickly. This is a better thing to talk one-on-one about, but a common thing that can happen is this. When a person receives SSI benefits are made to cover your basic food and shelter. Social Security feels that you, me, or the man in the moon should be paying 1/3 of our income towards our shelter, our housing costs. If a person is living in a situation where they are rent-free, Social Security, if you receive SSI benefits, can reduce your benefit by 1/3. They will not send you 1/3 of your benefit, which means your check would go down to, I believe, around $466 a month just because you're not paying rent. The most common example of this are the individuals that we serve live with family. They may live with parents, they may live with a sibling, and because of that, because they only get a little over $700 a month in benefits, that family member does not charge them rent. They may live with a friend, and that friend does not charge them rent. If they're not paying anything for their housing costs, Social Security will reduce their benefit check by 1/3. That is something to really have a discussion about with the folks that you're serving. Resource limits. Social Security has a resource limit amount of $2,000 for an individual and $3,000 for an eligible couple. This is how much money they count in resources at the beginning of a given month. The most common example of this is how much money is in the bank. If a person has more than $2,000 as an individual, pardon me, or more than $3,000 as an eligible couple, that technically puts them over resource and they can stop receiving their SSI benefits until that resource limit is under that cap. One of the best ways around this rule is for a person that is on SSI, if they begin working, to apply for that MEPD program Diane mentioned earlier. If a person that is single gets on MEPD, that income limit, that resource limit, changes from $2,000 to $12,000. If there are a couple, that resource limit changes from $3,000 to $13,000. They get a $10,000 bump by simply going to work. That is one of the greatest work incentives that we have, is individuals allowed to have more money in the bank, ability to move themselves out of poverty. Here's some common exclusions. This is archived. You can read what many of these are, but there are many things such as life insurance policies, financial aid, different things that even do not count against you. The biggest one to talk about this time of year are tax refunds. Tax refunds are not counted against SSI benefits. And the reason for that is that when a person initially worked last year, they would have taken that money into account with SSI benefits when they made the money in 2014. So Social Security does not double dip and penalize you twice for those incomes. So if a person asks you, hey, I received my tax refund, do I need to report that to Social Security? Is it going to affect my benefit check? The simple answer to that is no, it does not. How does income affect SSI payments? I'll go through this quickly because we have an example on the next slide. But while Social Security has what they call substantial gainful activity when you're on disability, which is at 1,090, you can earn before it affects your benefits check. On SSI, that does not exist. That is not the limit that affects your benefits. One of the first things to know about SSI checks is that they are not all or nothing. When SSI checks are affected by working, they are reduced. If Diane is on disability and she makes over substantial gainful activity, they will not send her a disability benefit. If Diane goes to work on SSI, instead of them just stopping her check, they will reduce her benefit check. Now, they very well may reduce her benefit check to 0, depending on her earnings, but the first thing is that they step it back. It is not, oh, I hit this, my check stops. They reduce it due to a calculation that we're going to show you here in a moment. One of the first things to understand is that when you are working, the first $20 of any kind that you get in a month, Social Security does not care about. I know that's not a lot of money, but the first $20 that anyone gets in a month on SSI is not counted. If that person is also working, the next $65 is not counted. A shortcut of this would be if you're working and you're receiving SSI, and those are your only two income sources is work and SSI benefits, you have $85 you can make in a month before Social Security begins to reduce your benefit check. Again, that does not sound like a lot of money, but there's more to the story. Here's how SSI looks at earned income. So let's pretend for a moment that Diane makes $885 from employer X. Does not matter where she works. The first thing that happens is Social Security takes off $85 that they don't count. $20 is what's called a general exclusion, and the next $65 is what they call the earned income exclusion. But what that really means is there's $85 that they don't count. So $85 from 800, and you're going to see why we picked this number, makes our math easy. But $85 from 800 leaves us $800. Excuse me, 85 from 885 leaves us $800. What happens next, and this is the biggest reason why a person should work, is that Social Security then cuts that amount of money that's left over in half. So we have $800 left. Social Security only counts $400 of it. So what happens is a person goes from getting $733 in an SSI benefit. My slide is incorrect. This is the 2015 number, not 2014. But a person goes from getting a Social Security SSI benefit from $733 to $333. However, they also continue working, so they have an SSI check of $333 plus a work amount of $885, which means they have a total gross income of over $1,200. When a person obtains and maintains work on SSI, they can never have less money. Again, of a shortcut to take home with you this evening, ladies and gentlemen. If you have anyone that you're serving that is receiving SSI benefits and they're thinking about going to work, there is no way that if they obtain and maintain employment that they will ever have less money. The last thing on the slide that you see in front of you is the list of a 2-month lag. Here is why. If Diane is working and she goes and reports her income at the end of March, if she runs that amount of money down to Social Security, there's no way the Social Security can adjust her check that's coming on the 1st, okay? So Diane got paid last Friday, or Diane gets paid at the beginning of next week. Social Security does not have enough time to edit a check she's going to get on Wednesday. So they reduce the following month's check. So if a person is working in the month of March, their check will be affected the month of May. If a person is working in April, those earnings affect their June check, so on and so forth. That is also why if you're on SSI, I stress obtain and maintain employment. Because while there's a 2-month lag to reduce your check due to wages, if your wages stop, guess what? It also takes 2 months for them to rebound. So it is very important for persons that are on SSI to not only get a job, but maintain the employment for as long as they can. Very quickly here, if a person is receiving SSI benefits, one of the first things that happens is that if their wages reduce, then they just need to report that to SSI. Even if a person stops receiving their benefits check, they can continue receiving their Medicaid as long as they don't go over what is called our state threshold. That amount for this year is a little over $32,000. Again, if you were to relocate to another state, have colleagues in other states, you can find out the Medicaid threshold by just Googling that term, Medicaid state threshold, and it will tell you what that amount of money is for that particular state. There are some work incentives. I won't go into detail with these for interest of time, but I will say this. If a person is in school and they're working, a lot of the income that they can make, if they're a young person, does not count against their benefits. They have what are called income-related work expenses, which is medical expenses per month, can be counted against your wages to reduce what is counted. There are blind work expenses. So these are work expenses that specifically if a person experiences blindness One of the biggest ones are taxes. So if a person is blind, Social Security can actually count the taxes that are taken out of their paycheck against their wages, which means Social Security can count the net instead of the gross. If a person is blind and working, and a plan to achieve self-support is similar to the ABLE Act, which is where an individual can set aside money to save towards an expenditure that will help with their self-sufficiency, and Social Security does not count the money in that bank account as a resource.
And Brian, we have another question. Is
Yes.
there a limit to the length of time you can be on SSI?
No. When a person is on SSI, they can be on it unless their wages dictate they change programs. So there's no age limit. What does happen is this. If a person is on SSI and they go back to work, they start accruing work credits. So what can happen is if a person, and this is on SSI, especially if they're young, if they're under 31, they can actually make enough income where they are actually transitioned from SSI onto disability. And if that becomes the case, all those things that I mentioned about unearned income, getting married, those things affecting their benefits no longer applies because now they're on disability benefits.
All right, thank you.
Yes. If you're serving someone that receives both benefits, so they receive SSI and SSDI, that person is called a concurrent beneficiary. Well, I suggest any person that you're serving speak to a benefits planner, especially if they're considering going to work. If you're serving anyone that receives both SSI and disability, they most definitely should talk to a benefits planner because all those work incentives I talked about and that Diane talked about, some are disability and some are SSI, all of those apply to people who receive both benefits. So their cases can be a little more convoluted, which is why you definitely want to talk to a benefits planner.
In the essence of time, we're not going to talk much about Ticket to Work. It is a benefit that you have where you can work with benefits planners, career counselors to help you with getting back to work, and just know that that's available for you. At the end, we're giving you a lot of information about people you can contact to help you with that. So things to remember, everybody can go back to work. You can work and maintain your benefits, or you can gradually transition off benefits. You can always maintain, maintain Medicare and Medicaid, and that you always, always, always need to report those wages to Social Security and get a receipt. So we suggest that you either walk in and get a receipt, or that you fax it, because then you have the fax transmission sheet that can be that. And if you can get your ticket to work, that's an awesome deal.
Diane, there's another question. I don't know if you can see it in the chat box or in the question box. It's kind of long.
Yes.
Or I can just go ahead and read it. So someone's son was disabled before he was 18, and he started receiving SSI when they helped him apply when he was 18. But as his parents, we've paid into Social Security for 30 years. So why did he get put on SSI? And it says, I thought you said as a child they could get SSDI under a parent's name.
Yes, you can. However, and that's a great question. So let me explain. What she mentioned is called child disability benefit. In order for a child to draw off their parents' work record, a couple things need to happen. First off, the child has got to have experienced a disability before age 22. It does not mean that they're on benefits. In her example, her son is. But if there's records showing that your disability existed before you turned 22, you're eligible to draw for your parents' work record. But, and this is one of those big buts that I mentioned at the beginning. In order to do that, one of your parents has to either retire, become disabled themselves, so they go on disability benefits, or they pass away. So if both her and her husband are still working, that is why he is not receiving the benefit. When one of them retires, becomes disabled themselves, or unfortunately passes away, he should go on their work record. If either of them have already retired and he is not drawn off their work record, then they should contact Social Security and make sure that Social Security has him listed as a dependent. More often than not, this is an automatic process, but I did have a recent situation where it just wasn't caught and a phone call fixed it. So if either her or her husband have retired and their son is still drawing only SSI, then they should contact Social Security to make sure they understand that he is their child and that he's listed, so then he can begin drawing off of their benefits.
So does that answer that question?
I think so. We have another one as well. And then that'll probably be the end of questions. And then we'll have everyone who has additional questions to feel free to reach out to Brian or Diane at the end of the webinar through their own contact information. But this lady is wondering, what if someone is receiving SSDI and also gets a pension disability? How does that affect their benefits?
It does not. If a person is receiving a pension and they also qualify for SSDI, pensions are considered unearned income, and it does not affect them. Now, that being said, some pensions, maybe getting disability affects the pension amount. It probably does not. But when it comes to does the pension affect SSDI, typically it does not affect SSDI, but sometimes SSDI can affect other services. So with that, she wants to talk to whoever holds the pension benefits and double check to make sure if that was something that would affect that. But pension plans do not typically ever affect SSDI benefits.
Because pension plans would be considered unearned income, and with SSDI, it's all earned income. So that should help that. And as far as contacting people, we have 2 pages at the end. One is benefits planners, where to get assistance. So wherever you are in the state, you should be able to use one of these 2 links to be able to look at benefits planners in your area. And then we also have our information. So even if you're not in our area, but you want to contact us and find out how to find a benefits planner, if you have questions from this session, please do not hesitate to reach out. And are there any other questions?
I don't see any at this time. Thank you everyone for attending, and thank you Brian and Diane. Like I mentioned before, this webinar will be posted on the Brain Injury Alliance of Iowa website within the next couple of days. Also, an email will be sent to all attendees within the next hour or so, verifying your attendance along with a link to a survey. Please feel free to fill out this survey with feedback on our webinar. And with that said, thank you again, everyone, for attending and spending your Sunday evening with us. And thank you again, Brian and Diane, and have a great rest of your weekend. Thanks, guys.